Welcome to Genetics Decoded. I'm your host, Sharon Palmer. What we do in this podcast is we go in and we look at the intersection between your genetics and your health. Today, we're going to tackle the topic of histamine intolerance. There's certainly a lot more interest, but right now people are scratching their heads going, is there even such a thing as histamine intolerance? Let me clear that up right away. There is absolutely such a condition as histamine intolerance. Your genetics is playing a really, really big role here, as are a range of other issues. So there can be more than one factor. We're going to go in today and look at what could cause histamine intolerance, look at how it could be impacting, like what kind of symptoms could you be experiencing, how would you go in and effectively treat histamine intolerance. And the thing that really blew my mind as I was preparing this podcast is that the use of antihistamines is one of the causes of histamine intolerance. So if you're taking some antihistamines, you want to stay with me as we go in and really understand what is this histamine intolerance. Today we're going to be having a really good look at histamine intolerance. Overall, histamine intolerance has really been flying under the radar for quite a while. We are starting to see some interest, but when we look at all the other food intolerances, things like gluten and lactose and fructose, we've been a little bit more on top of it, we've been a bit more understanding. But histamine intolerance has kind of garnered some attention, but we don't really know what to do with it. And there's been some really good reasons why it isn't as clear cut as some of the other ones. When we look at histamine will end up in our blood system. And of course, once it's in the circulation, it ends up being transported around the whole body. And all of the effect of histamine is exerted through the histamine receptors. And there are 4 separate receptors, and H1, 2, 3, and 4. And again, they're dispersed very widely through the body. So histamine gets taken out into the body to every kind of system. You've got all of these receptors, and that means that the symptoms that are associated with histamine intolerance are really diverse. When we look at the research, we see that the majority of people have 11 separate symptoms associated with having histamine intolerance. And this is where you think, people come in and they've got all of these symptoms and you kind of think, well, what's going on? Or you think, well, they're a bit of a hypochondriac. How can you have that much happening? But those symptoms are also not just specific to being histamine intolerant. They can really be associated with a lot of the other food intolerances. So it's been kind of complicated, it's been kind of diverse. And, up until now, we've not had our genetic data. So we've not been able to go in and understand that genetics is playing a really big role here and going in and really clearly identifying people who have some of these risk factors. So stay with me today as we really go in and unravel and look really deeply at, what is histamine intolerance? How can you tell that you have it? What are the kind of symptoms that you would be experiencing? And, what can you do about it if you are suffering from histamine intolerance? The first thing we want to really establish is if people are going to be reacting to histamine, how does histamine end up in the body? Like, where does it come from? And there are really 3 distinct areas that we have to be focusing in on. First and foremost is our food. Histamine is distributed quite widely through a lot of foods. So again, this is where some of the complication comes. We're eating foods regularly that are high in histamine. Some are low, some have quite a lot. Later in the podcast, we're going to go in and just look at what these foods are. But, every day you would be introducing some of this histamine through your diet. We also produce our histamine within the body. We take something called histidine, which is one of our amino acids, and we convert it into histamine. And that histamine is then kind of put inside our mast cells and our basophils. So a lot of people who have heard about histamine or have kind of been getting allergies, they often kind of know about these mast cells. So what will happen is you will produce this histamine, you will put it in the mast cell, and then when an allergen comes into the body, that mast cell will be triggered to break open, and then you will release all of that histamine into the surrounding tissues and into the bloodstream. We know that your gut microbiome are producing histamine. And so it's going to be really important to assess your gut microbiome. There will be certain strains and species that will actually produce histamine, and there will be other strains and species that can help to support you removing that histamine out of the body. So really understanding what type of bacteria are in your gut is going to be important. But again, when we come to look at, what are some of the treatment interventions, our use of probiotics. So there will be some probiotics that might be really valuable to be introducing if you've got histamine intolerance, because they're going to help to degrade it and remove it. But there'll be some probiotics that are going to actually make your histamine worse, and then you have to stay away from them. So the three main ways that histamine is coming into the body is through the food that you eat, through making it and storing it in your mast cells as part of your immune and allergic reaction, and through the gut microbiome. If people have histamine intolerance, let's kind of try and really define what does it mean. And if we really look at it, it is simply an imbalance in the levels of histamine. So is there too much coming into the body? So too much coming in either through the food that you eat, or perhaps your mast cells are constantly breaking open and releasing this histamine. Maybe your gut microbiome is making too much of it. But all of those things will contribute to the amount of histamine in your body. You then have a set of enzymes, your histamine degrading enzymes, that break that histamine down and remove it out of the body. And if you have too much coming in, too much in the system, and you're not able to effectively remove it, then you're going to end up with too much histamine, and this is where we can start to become sensitive to it. Now, genetics is very clearly showing us that the ability of those enzymes to remove histamine vary from person to person. So if you've got some genetic risk factors and you're not able to break it down very well, and you've got a whole range of factors where it's coming in, histamine builds up, and then we begin to have this reaction to it. That's really what we mean when we're talking about histamine intolerance. Let's examine why we could end up with histamine intolerance. And again, it's not clear-cut. There's not a single risk factor. Certainly, we know that genetics is playing a major role, but it's only one of a number of roles. So there are 6 key areas that can lead you to end up with histamine intolerance. You could have any one of these operating, you could have all 6 operating, or you could have any combination of that. But the first one we're going to look at is your genetics, because what we really clearly see now is if you've got genetic risk factors that are decreasing your ability of the enzyme to clear histamine, if you've got those genetic risk factors, it is the number one cause of histamine intolerance. And it is really easy these days to go in and screen that. Now, everyone listening will have the ability to produce these histamine degrading enzymes. You have a particular gene, it's called DAO, and it produces an enzyme called diamine oxidase. And the whole role of that enzyme is to metabolize and clear this histamine out of the body. Now, for some of you listening, that enzyme will be working really effectively. It will be doing a great job at breaking down that histamine and removing it. Now, some of you will have a genetic defect, a genetic variant, in that the enzyme is working less effectively. It's slowed down. It's not that it's not working at all, but it's decreased in activity, and that will mean that these will be the people that are going to be more slow at clearing that histamine out. And then, of course, if there's a whole lot coming in, they can end up with too much histamine. And then some of you will be very unfortunate in that you'll have significant genetic risk factors in which that enzyme will be almost not working at all. It will be severely decreased in capacity, and your ability to clear that histamine, no matter how it's coming into the body, will be severely limited. One of the things that I really recommend is if you're trying to figure out whether you have histamine intolerance, is really start by going in first and looking at the genetic variances. And this is where we need to be a little cautious here, is that it's not just one genetic variance, there's about 5 or 6 that you have to look at. And we know that the frequency of these genetic variances change across ethnic groups. So the genetic SNPs that you need to look at and assess for Caucasians will be different to those that you need to assess for people who are Asian ethnicity or who are Africans. So if you're doing genetic screening, you've got to have a pretty good look at a whole range of SNPs. If there's just 1 or 2 being reported and they're not the ones that really tie into your ethnic group, then you might not get a really good look at whether you are histamine or intolerant or not from a genetic point of view. But the first thing is go in, screen to see if you've got these genetic risk factors, and if you do, then you're going to need to be very proactive around a whole range of your interventions. Now, if you've got these genetic risk factors and you've got a whole range of these other factors that we're going to look at very shortly, then that kind of combines together to create some really big problems. There's more than one thing that could be playing a role, but you might go in and do your genetic screening, find out that you don't have any of these genetic risk factors, but there may be some other things playing a role that you also want to know. So you want to get this big picture overview of all the things that could be contributing to histamine intolerance, because then you're going to have a much better capacity to target the things that are playing a role and get the outcomes that you're looking for. The second cause of histamine intolerance is the fact that you might have some other clinical conditions or certain diseases. And the ones that are playing a really big role here, a lot of the diseases associated with gut problems and autoimmune gut issues. So that includes things like Crohn's disease, ulcerative colitis, IBS, celiac disease. If you've got any of those other issues from a health point of view, what we're finding is those diseases are leading to your DAO enzyme being decreased in capacity. So you have these other diseases, they are impacting on the activity of this enzyme, independent of whether you've got genetic risk factors, and what they're doing is they're beginning to slow down your ability to clear that histamine. We know that people who have colon cancer, again, it can lead to a decrease in the activity of this enzyme. We know that people who have viral hepatitis, it can also lead to a decrease in the ability to clear histamine. And for any of you who are on chemotherapy treatment, again, chemo can decrease the clearance of your histamine. And this is where sometimes there might be certain treatments that you're going through and you think, oh, wow, I never seemed to have a problem with this food before, but now I can't seem to tolerate it. So know that there are certain disease states, certain types of treatments that, independent of your genetics, can lead to this enzyme that is clearing histamine just not doing such a good job. The third thing that can impact around your risk of histamine intolerance is prescription drugs. Every time I go in and look at the research, I get more and more concerned with some of the side effects of prescription drugs. And this is another area that we need to be cautious with. There are so many prescription drugs that can decrease the activity of your enzyme that is clearing histamine. In fact, there's so many that I can't even begin to list them. There is more than 90 drugs that will be quite commonly prescribed that will downregulate the activity of this enzyme. And I would guarantee you that, when I go through this list, I don't think anyone would have ever said to you, oh, be careful, your ability to clear histamine might be compromised and you might become a little bit more sensitive to foods. So some of the class of drugs that we're looking at here are a number of antibiotics, a number of drugs that are prescribed for treating high blood pressure, a number of drugs, for anxiety and depression, so a range of your antidepressants, and there's a whole range of non-steroidal, so your non-steroidal anti-inflammatory, so people are using them for pain and inflammation, can again begin to decrease your ability to clear your histamine. And if you've just started on some drugs that will decrease your histamine, you need to kind of, try and connect the dots a little bit and go back in. If you've just started on some new medication, finding out whether it really does have the ability to decrease the ability to clear that histamine, maybe making you a lot more sensitive to foods that you were okay with. And I think the greatest irony of all, so again, as I was going in through the research, the class of drugs that can really decrease your ability to clear histamine are your antihistamines. So go figure. So you have an issue with histamine, you take an antihistamine, it decreases your ability to clear that histamine, and you get the picture, right? You're just locked into this cycle. So again, your antihistamines can decrease your ability over time to be clearing that histamine. The other cause of histamine intolerance is our food. We know that food has a lot of histamine. Some foods have a little. Some foods are really high in histamines. And again, the very first intervention, and we'll talk about this in more detail, is going in and, understanding the foods that are high in histamine. But there are also, there's these other amines, so we've got histamine, and there's a whole range of other amines that are in your food, and these other amines can compete with the enzyme that is clearing your histamine. So what happens, you eat these other amines, they are competing with that enzyme, so they're taking up its time, and that means that you're less capable of clearing that histamine. And then you've got some foods that have compounds in them that can directly decrease the activity of that enzyme. So your food can work in a number of different ways. And it's really interesting, at a clinic level, often trying to encourage people to eat more fish. It's high in these essential fatty acids. We know it's high in vitamin D, but fish is a food that will cut across all of those things that I've just told you. So fish can be really high in histamines. It also has another lot of amines that will slow down the activity of the histamine clearing enzyme, and it also can directly decrease the activity. So again, this is why there may be certain foods that on the surface may look really beneficial for other areas of our health, but if you're having some real issues around histamine, you might not need to be consuming it or consuming it at all or at certain doses. Number 5, the fifth thing that can lead to histamine intolerance is alcohol. I know, it's very sad. So certainly beer and wine can, you're going to find out that those things are not only really high in histamine, that alcohol and the metabolites of alcohol can be competing for that same enzyme. So again, we may need to really curtail people's intake of alcohol if they've got issues with histamine. The sixth and final is malnutrition. If we look at any enzyme in the body, so not just the enzyme that is clearing your histamine, they have essential cofactors. So for people who may be malnourished, who have significant eating disorders, and so they're not getting really good nutrition in, they may be not having enough of these essential cofactors, and that then begins to decrease the activity of the enzyme. So those are the 6 key factors leading that can contribute to histamine intolerance. And at a clinic level, it's really important that all of those are assessed because, as I had mentioned, any one of them could be playing a role. You need to know which ones are playing a role for you so that you can, again, put the correct intervention into play. We're going to go in now and have a little bit of a look at Now, what are the kind of symptoms that are associated with histamine intolerance? I had kind of started by going that, the symptoms can be really diverse. We know from the research is demonstrating that 97% of people with histamine intolerance will have at least three different symptoms, and that the majority of people have 11 or more symptoms. And the reason for that is, as I said, histamine ends up in the bloodstream, it gets taken to every part of the body. You've got a whole range of different receptors that are sitting in different systems, and this is where you can see this reaction to histamine. What I'm going to do now is we're going to go through each of the systems in the body that can be impacted by histamine intolerance. We're going to look at the type of receptors that are embedded in that system, and then what are the common symptoms that you would expect to see. And this way too, if you're experiencing any of these, you can start to think, maybe I need to go in and assess whether I really do have some issues around histamine intolerance. The first system we're going to look at is the gastrointestinal system. And of all the places that histamine intolerance can show up and cause problems, the majority of them will be around the gastrointestinal system. All four receptors, your H1, 2, 3, and 4, they are all going to be within that gastrointestinal system. And it's the really common things. It's going to be things like your bloating, your diarrhea, your constipation, your nausea, this kind of sense of fullness. So once you've eaten, you just think, I haven't eaten a lot, but I just feel like I feel stuffed. I feel really, really uncomfortable, nausea, vomiting. Those are all signs of histamine intolerance that are centered within the gastrointestinal system. But if you've got other food intolerances, and that includes gluten and lactose and cow's milk and fructose, they can all lead to exactly the same symptoms. And this is why it's so difficult at a clinic level, if someone's got these symptoms, to go, it's because you've got that food intolerance or you've got that food intolerance. And this is the real value of genetics, is you can go in and you can look at all of them and you can very clearly work out in advance what are the foods that need to be removed. What is the intolerance or intolerances that you're actually dealing with? The other system that you see a lot of symptoms is around the nervous system. That system has receptors there. Those receptors are your H2 and your H3. So not as many of those different receptors in the nervous system, but in the nervous system, what you're going to really begin to see is headaches and migraines. And again, so many people come in and they've got these headaches and migraines, and knowing that if you do, that you really do want to go in and find out whether histamine is playing a role. We also know that histamine intolerance can show up around things like dizziness and vertigo. Histamine can really impact around your cardiovascular system. The receptors that are in the cardiovascular system are what we call your H1 and your H2 receptors. The kind of symptoms that you would be expecting to look at is that histamine can cause this vasodilation, and that can lead to a drop in blood pressure, which can even end up leading to things like fainting. But as much as it can trigger things like, low blood pressure, we know that for some people it can also lead to high blood pressure as well. There can be issues with histamine intolerances around the heart. So you could have tachycardia, so that's an increased heart rate. It can lead to arrhythmias. So again, if you're kind of getting distortions in your heart rate, like it's beating too fast or it feels like it's skipping a beat, especially after ingestion of certain foods, again, go in and find out whether histamine is playing a role here for you. We've got the respiratory system, and for most of you who've had kind of any issues with allergies or hay fever, you're going to be very aware that this is a system where you really begin to notice that. The receptors that you're finding, the histamine receptors here, are your H1, 2, and 3. And the kind of symptoms that you would be expecting to experience could be things like asthma, like nasal congestion, the nose is really blocked, sinusitis. We know that if your nose is dripping or running all the time, that can again be signs of histamine intolerance. But we see that within the respiratory system, histamine can lead to kind of this constriction and bronchial spasms. Again, this is where you see some issues around asthma, sneezing, coughing. All of those are signs of histamine acting within the respiratory system. Then we've got your skin. And again, anyone who's having issues with histamine have often noticed all of those skin issues. The receptors, the histamine receptors that are sitting in the skin are your H1, H2, and H3. What you can kind of see here are eczema, all of that redness, swelling, itchiness, hives, welts. They're all signs of that reaction of histamine within the skin. There's a couple of other really key symptoms that don't fall neatly into those other areas that we've just looked at. But for any of you who are experiencing kind of muscle pain, especially it's something that's been there for a long time and it's not going away, any of you with fibromyalgia, and any of you with chronic fatigue, what we know is histamine intolerance can really be a big factor. So if you've got any of that clinically, go in and have a look at whether you have histamine intolerance. When I was doing some research for this podcast, I found some really interesting facts, and I'm going to share some of them with you now. And if you're a woman, then we're finding that histamine may actually have a lot more of an impact for you than it does for men. And that doesn't mean that men can't have a problem, but we're seeing that they might be a lot more sensitive and end up with a lot more clinical fallout from being histamine intolerant. So if we look at women during the course of their menstrual cycle, we are finding that women are much more sensitive to histamine in what we call the luteal phase of their cycle. So that's the second half of your cycle. So once you've ovulated and then basically the 2 weeks prior to your bleed, that is the luteal phase. Women are more sensitive to histamine during this phase of their cycle. And in fact, what we see is the body wants to and tries to upregulate the activity of your histamine clearing enzyme. It says, well, you're more sensitive. Let's get better at removing that histamine from the body. But if you've got genetic risk factors in which you're not very good, that enzyme is not working very well, you're not going to be able to upregulate it. And this is where you may find that foods that you tolerate well in the first half of the cycle, you may be less tolerant to them in the second half of the cycle. If you've got fibromyalgia, and we just kind of mentioned that, what we're seeing from the research is that 74% of women with fibromyalgia have at least one of these genetic risk factors that are leading to a decreased capacity of that enzyme to clear histamine. So if you've got fibromyalgia, particularly if you're a woman, go in and genetically screen here. Find out whether you've really got to pay attention to getting histamine out of your diet. For any of you suffering from headaches and migraines, particularly if you're a woman, then you want to find out whether you've got some of these genetic risk factors. 85 to 90% of women with headaches and migraines were found to have, again, at least one genetic risk factor around the activity of this enzyme. And what we found in that study was that when they removed histamine or went on to a low histamine diet, their symptoms decreased, so their headaches and migraines decreased in frequency by 90%. So again, any of you women really struggling around headaches and migraines, go and find out what is happening genetically here with your capacity to clear histamine. If any of you have been diagnosed with ADHD, and that seems to be quite a lot of people these days, we are seeing that the presence of these genetic variances around the activity of your histamine clearing enzyme can contribute to the development of ADHD and also to the severity of ADHD. Researchers were doing a pilot study in children and adolescents, and they found that 80% of them had a genetic risk factor around not being able to effectively clear your histamine. So, again, if you've got this diagnosis of ADHD, go and find out whether histamine is playing a role here. Normally, you would try to keep histamine away from the brain. Your blood-brain barrier should be quite resistant to histamine, but of course, if you've had some problems and your blood-brain barrier is not in good shape, histamine will readily cross. But we see that during in utero and in early development, we can see that histamine within the circulation can cross the blood-brain barrier. So histamine may be playing some really key roles at key development stages. And this is where too, if you're a pregnant woman or you've got a young child, again, going in and looking to see whether histamine and needing to decrease histamine in your diet is going to be really important. Some of you might have already gone out and done your genetic screening, or you might already know that you've got some issues with histamine. The thing we're going to look at now is if you've got histamine intolerance, what do you need to do about it? What are the interventions? And the number one intervention, the place that you would always start, will be around your diet. There are foods that are high in histamine. Some foods have histamine, but it might be at low levels. But there are foods that are high in histamine, and you would need to really work towards getting them out. I'm not going to run through all of them, but I'm going to kind of pinpoint some key ones. And that way, too, is if you're listening to this podcast and you've been reacting to certain foods and you're not sure what's going on, and then you find out, wow, they're all high histamine foods, it might be worthwhile going in and screening. So I'm going to kind of read through this list here. Now, if we've got somebody with histamine intolerance, these would be the foods that you would get rid of at least in 90% of the people. This would be your absolute starting point. Beer and wine needs to go. Oh, I know, cry, cry. Cabbage, especially fermented cabbage. And how many of you now are going, oh, I know that all these fermented foods are really important for my gut microbiome. And I've gone down to my local farmers markets and I'm buying my sauerkraut and my fermented vegetables. They will be really high in histamines. And so for some of you, they're not going to be good dietary interventions, even though on the surface it might look like they've got some benefits. They'll be really high in histamines, and if you can't clear histamines, they're going to be problematic. Cheese, all kinds of cheeses, citrus fruit, so again, oranges, lemons, grapefruit. A lot of women I know especially, they kind of go, one of my triggers around headaches or migraines is when I eat oranges. That's been pretty well established, but again, they're high in histamines. Your fish, and we spoke a little bit about fish, particularly your fatty fish, so your salmon and your mackerel. Now, the less fresh your fish is, so starting to get that bit of that smell, the less fresh your fish is, the higher its histamine content. When it's really fresh, it doesn't have that much histamine, and if it's been caught and frozen immediately, again, it won't have that much histamine. Spinach. So all of you who are doing your little kind of smoothies in the morning, grabbing that handful of spinach and throwing it in, thinking, oh, it's got all of these really good nutrients, also really high in histamine, as are your strawberries. So who's putting some frozen strawberries or fresh strawberries, handful of spinach, you're starting to really bump up that histamine intake. And the last one on that list is tomatoes. So those would be the foods that we would, pretty much, if anyone's got histamine intolerance, we would be looking at like either getting them completely out of the diet or really, really significantly decreasing intake. Then we've got another set of foods that aren't quite as high in histamines, but again, in probably 60% of people, you would really start to either start there or go there if the other foods being removed was not giving you the outcomes. One of them is avocado and one is egg. So who is going out and having their avocado smash and putting their poached egg on the top? Lots and lots of histamines. Maybe you've put it on a bed of spinach and you start to see the intake of that histamine can go up. So it's not about foods being good or bad. It's that some foods are high in histamine, and if you can't clear them, you're reacting to them, they're not going to be good for you. Chocolate. Oh no, chocolate is on the list. And how many of you women during the second half of your menstrual cycle, your luteal phase, start to crave chocolate? And what do we know? That is when you're more sensitive to those histamines. So maybe you need to find a different food to kind of crave during that luteal phase. Eggplant, that's a bit of a weird one. Eggplant's high in histamine, and there's a whole range of nuts also that you need to consider. So these are really common everyday foods, but in some people, it may really be causing a problem because they're not able to remove that histamine, and these foods are just introducing way too much of it in. The second area that you would want to really focus in on around histamine intolerance is the gut microbiome and probiotics, either looking at introducing certain probiotics or staying away from some probiotics. So we know that there are gut microbiome, certain species that are producing more of this histamine. And a lot of them fall into that lactobacillus category. And again, what I see a lot is we're more aware of the gut microbiome. People are thinking, oh, I should take a probiotic. If I just go and take a probiotic and I just take it every day, I'm introducing all of these really important species into my gut and it's all going to be good. It just doesn't work like that. And in fact, maybe you're introducing species, like you're taking the same probiotic over and over again. You've been doing it for a long time. And what you may be doing is increasing your ability to produce that histamine. And one of those is something called L-casein. And that's a pretty common species that you'll find in a lot of probiotics. Then there's other species that can really help to degrade and remove histamine. And one of those is bifidobacteria. So bifido is a predominant bacteria when we're young. But, in clinic, and if you've listened to any of these podcasts, we often talk about non-secretors maybe never being able to colonize bifido. And again, there's this layering of effect. If the gut microbiome has certain things, it may support your ability to clear histamine. It may contribute to your problem around histamine. There are also some probiotics that work through the histamine receptor, and specifically through the H4 receptor. And that is Lactobacillus rhamnosus, often goes in the marketplace under like an LGG, is that you will see a lot of practitioners who will use that when they've seen that IgE, which is kind of that immunoglobulin that's high when there's these allergic reactions. They're often prescribing Lactobacillus rhamnosus, and the way that it's working is through blocking the H4 receptor. And this is where, too, we can go back and we can look, where does the H4 receptor show up? So we went through some of those systems. It's not through all systems, and so this is where, again, you can get more targeted. What kind of symptoms are people getting? Do they have a problem with histamine? And what is the best probiotic for me to pick? Because they're not working equally and they're often not working in the ways that people on the surface think. The third thing is looking at, well, if your own enzyme is not working, so this DAO enzyme that is clearing histamine, if that's not working because you've got these genetic risk factors, or maybe you've got some of those other diseases that are slowing it down, well, doesn't it make sense to just go, let's put it into a supplement and let's just swallow it? And Those things are beginning to happen. It's not mainstream at this point. There are some countries that have green lighted the use of this DAO supplement for certain medical conditions, but I'm sure that as time goes by, you will start to see more of these supplements coming into the market and maybe becoming mainstream. The place that we're finding and getting this enzyme is from the kidneys of pigs. So, all of you vegans and vegetarians, you might not be that keen to go down that pathway. The fourth area to focus in on is nutritional supplementation. And again, that could be specific around your probiotics, but we had spoken around these essential cofactors. Again, B6 is one of these essential cofactors. So we might cherry pick certain nutritional supplements to support, make sure that those cofactors are in play. And number 5, and probably I would think outside of diet, it's almost like, okay, I've got a problem with histamine and I'm reacting to histamine, I'm sneezing, I've got hay fever, I'm going to take an antihistamine. And you should be thinking a little bit about that now, because we've already spoken about what's one of the classes of drugs that can decrease the activity of your enzyme that clears histamine. It is your antihistamine. But again, as I was going in and doing some research, your antihistamine drugs, they are impacting on your health in a lot of ways, and in a lot of ways that we should be very concerned about. And the problem is too, if we get prescription medication, I think we often go, well, we know that there's certain side effects, but I'm taking it because my GP has recommended. But then if we are able to just walk into a chemist or pharmacy and buy this over the counter, I think our perception is, oh, there might be side effects, but they're not that serious, because if they were, they wouldn't let us just be able to buy it over the counter. And that is not correct. What is the fallout from taking antihistamines? The first is that it really disrupts your mitochondrial function. And again, if you've been listening to this podcast, you will know that focusing on your mitochondrial health is so important in so many different ways. But if you're taking an antihistamine, it is disrupting the activity of your mitochondria. In fact, what we're beginning to see is that for people who have acute myeloid leukemia, which is a type of cancer, is that they are being prescribed antihistamines, because the antihistamine is so profoundly impacting on the activity of the mitochondria, it is interfering with how that cancer can work and grow. Now, if it's doing that to a cancer cell, what is it doing to all the mitochondria in your own cells, especially if you've been taking it at high doses or you've been taking it for a long time? Really think about what it's doing to this really important, system that's going to produce so much energy within the body. Antihistamines can increase the risk of dementia. That's really scary, because again, Alzheimer's, dementia, we're seeing an increased rate. Now, it's not all antihistamines that can do that. There is a class of antihistamines called diphenhydramine. They were one of the first classes of antihistamines out, but what we're seeing is this class of antihistamines is going in and it's interfering with the ability of acetylcholine, which is a key neurotransmitter in your brain, playing a real important role around memory and learning. This antihistamine is going in and interfering with the activity of acetylcholine. And early Alzheimer's researchers were really focusing in on acetylcholine because of its key role around memory and around function. There was what we call a prospective study. So what these researchers did is they tracked people for 7 years, and they tracked people who were taking certain classes of drugs, and one of them was this antihistamine. And what they found is that the use of that antihistamine increase the risk of Alzheimer's by 54%. And again, we're taking these antihistamines, we go, I don't want to sneeze, but we're failing to understand that in the background, they can be really impacting on our health in very significant ways. When I looked at that research, I was like, wow, one, I've never had a problem with allergies and hay fever, so I'm not sure I've ever taken an antihistamine in my life. But I thought, well, it's one of the first kind of classes of antihistamine. How frequently would we be seeing it in products now? And again, a little concerning. What I've done is I'm going to read out the list of products that have this form of antihistamine in them. And again, it's called the diphenhydramine form of antihistamine. You are going to find that in Benadryl. How many of you are taking Benadryl? It is also in Benadryl D allergy plus sinus. It is in Robitussin. So Robitussin severe multi-symptom cough, cold and flu nighttime has this form of antihistamine. It is in Sudafed. So the Sudafed PE day-night sinus congestion has this form of antihistamine. It's in something called Banafin, Siladril, and in Unisum sleep gels. What I would really recommend, if any of you are taking an antihistamine, go in and find out if it has this class of antihistamine in it, and again, be very aware of its impact on cognition over time. If you've been listening to this podcast, these are some key things I ask you to consider. First of all, if you're already taking an antihistamine, go in, find out genetically whether you've got these risk factors around this enzyme not working, because we're seeing that the use of antihistamines has some really negative impact on our health over time. You don't want to be just trying to focus in on dealing with the symptoms. You want to get to the cause. If you've got any of these other conditions around things like fibromyalgia, chronic fatigue, headaches, migraines, again, it's a really smart move to go in and look to see whether histamine is playing a role. But don't just screen for histamine intolerance. Do all of your food intolerances at the same time. Your gluten, your lactose, your cow's milk, your fructose. That way you've got this very clear picture, because there could be certainly more than one of them operating. And again, you can make the right dietary interventions. As always, to know that the information that we've presented here today, it's not for medical advice. It really is just for your own knowledge base, helping you to understand how your genetics can interplay with the choices that you're making. If going down this pathway of personalised healthcare using your genetics is of interest to you, please remember you can contact us through iDNA Health. We provide our services to people all over Australia and overseas. We can post out your kit. We can take your 23andMe and your ancestry data, and we can use it. If you have enjoyed this podcast today, would really appreciate you going in and liking and subscribing. And again, if you've got any friends or family that you think, oh, they're taking antihistamines, oh, they have chronic fatigue, they've got a headache, share this with them. They might learn something really valuable. Thanks for listening to the podcast today. If we've started to increase your interest around clinical genetics and you think you would like to find out a little bit more, please feel welcome to reach out to us at iDNA Health Clinic. We're proud partners of this Genetics Decoded podcast. It's a real opportunity to get in touch with us and find out how you could go down this pathway yourself. If you liked the podcast, enjoyed it today, please go in and push all the buttons, like and subscribe. It really does make a difference and supports what we're trying to do here. We have a podcast release every Monday, so keep a watch out. All of our topics are around genetics and health, and we would love you to join us every week.